Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today I'm going to be discussing catheter care. Plus, I'm going to go over the directions of how to change from the night bag to the lag bag. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So to properly take care of a catheter, you want to be cleaning the insertion site daily, okay? So just with soap and water. For females, this can be a little bit different. But just general good hygiene and showering, you're golden, okay? You're golden with this. And then just periodically making sure that the line is not kinked. Okay, now this is, I am talking about a home care setting with this. So I'll start with the overnight bag so we can kind of get a good idea of all the things that we'll be using here. So the overnight bag is a larger bag with a longer tube, and it's to be used at night. Now you can also use this during the day, just when you're around the house, but you always want to make sure that you're holding the bag lower than your bladder. Okay, you never want it above, you never want it equal, you always want it below. This helps gravity pull the fluid out of the bladder into the bag because there has been cases, and I have seen this, where somebody has a catheter bag and they go from a sitting position and they hang it on their walker. Okay, so now this is above their bladder and you can see the fluid in the tube going back towards them. Okay, this is where infections start. So you always want to keep it below. Okay, so you have this large bag, you have your drainage tube here, and either they have like a twist tube or a snap one where you just snap it and flick it open. Okay, just depends on what type of bags you have. They have a bed sheet clip where you can clamp it. They have these little hanger straps here, and then your long tube that connects to the actual catheter that's inside of you. So the lag bag, this is a smaller collection container, and it helps when you go out of the house because it can be easily hidden underneath your clothes. Now, once again, you need to remember the bag needs to go below your bladder. Okay, so your bladder's up here, it needs to go below. Okay, and I want to mention here too, there are these catheter securing devices, as you can see here. These are wonderful. Okay, so then it's not always pulling on your bladder because there's a balloon that sits in your bladder. It's inflated with this side right here when it's inserted. So that's how it stays inside your bladder, because there's an actual balloon in there that sits right at the sphincter. Okay, so it can't come out. I shouldn't say can't because crazier things have happened. But we don't want tugging on that area, because when we go to put you without a catheter, for whatever reason that you have a catheter, if it's just for like a month or two, whatever it might be, even a few weeks, we don't want pulling because it can stretch the actual sphincter inside of your bladder, and we don't want leaking issues once we have this removed, right? So I always suggest these catheter securing devices. But this is really what the drainage collection bag looks like. Once again, this is either a twist or either you flick it, and it can be easily drained into the toilet. So as I just said, where it can be easily drained into the toilet, this person has it up a little bit higher, perfectly fine. It's just a comfort thing where you're going to put it as long as it's below the bladder. Now, I do suggest having it on the lower end of the leg, just because when you sit down, okay? Now, with that said, to drain it, this would just be a twisty one, and you can just drain it right into the toilet without ever disconnecting anything. Now, disconnecting or changing your drainage bag, okay? You're going to follow these steps. So as you can see in this picture, she's pinching the catheter line. So this is what goes into your body. Okay, this extends into your body. You're going to pinch here to prevent any urine flow. Okay, because you do not want the urine to just keep flowing out. So you pinch up here above, because this, where this connects, there's a piece in here still that makes it so it doesn't come out, right? So you want to pinch up above that, and then you would pull this out, okay, kind of in a twisting motion. Now you're going to clean both ends with an alcohol swab, okay? Clean both ends with an alcohol swab, and then you can insert either the new catheter bag, because catheter bags should be changed every week. So you're either going to put the new one on, or if you're changing between nighttime, daytime bag, just make sure that you're alcoholing the end of the catheter bag and the end of the actual catheter before you're putting another one back in. Now you also want to reduce the risk of infection. So you want to minimize the amount of times you're switching from your lag bag to the nighttime bag. So if you are at home, I mean, and you don't mind having the big bag with you, I mean, it holds more urine, less chances of infection. So if you are just hanging around the house, it doesn't hurt to stay in the nighttime bag. It's actually preferred that you minimize the number of times you're switching between the two. Okay. Also, on occasion, a catheter might leak. Okay. So it might have leakage around and just and out. Okay. With that said, this can be normal if there's lots of urine in your urine bag. Okay. If there is no urine in the urine bag, this is cause for alarm. Okay. That means that it's pushing itself out around the catheter because there is a clog somewhere and it can't get out. Okay. So we got to be very cautious and pay attention to these things. Okay, now cleaning and deodorizing the drainage bags. So you can use 2 parts vinegar to 3 parts water. You're going to let it soak for 20 minutes, okay? And then you're going to hang it with the empty spout pointing downward, okay, where it can, like after you've emptied it, just pointing downwards. Now you don't want to hang this over like a heat register or anything. You don't want to heat it up. You're just simply letting it air dry, letting any drainage come out or drip out. So have a little collection device underneath it, and just let it air dry. Now, what to report? If your urine all of a sudden has a really strong odor or becomes cloudy, this is a good sign of infection. So you want to report that. If you're experiencing fever, chills, lower back pain, so that's your kidney area, you want to report it. If you have pus at the catheter insertion site, swelling at the catheter insertion site, or if your urine is not draining properly, okay? Now with that said, if your urine's not draining properly, make sure you pull out the line, make sure there's no kinks in it. Sometimes even if your underwear are sitting and you're sitting down, it can like kind of pinch it a little bit. So just make sure you stand up, stretch out all the lines. If the urine starts flowing, you're golden. If it will not flow and you've tried lots and lots of things, you want to report it and a nurse will help you, okay? So I hope this video did give you a better understanding of how to care for your catheter and how to change out those bags. That's all I have for this video, guys. I hope to see you in my next one. Bye for now.